Hi, this is a video that's going to talk a little bit about your surgical experience. We'll talk about before your surgery, during your surgery, and after. It's going to be a guide to understanding your post-operative expectations. So I thought I'd start out talking about things to bring to the hospital. First off, you'll want to wear comfortable clothing. You'll also want to make sure you have loose-fitting clothing to wear home. Nothing restrictive, nothing too tight around your waist. You want to bring a CPAP or a BiPAP if you wear one. Bring a photo ID and your insurance cards. You want to leave all valuables at home, but you might want to bring a credit card because we do have a pharmacy that you can get your prescription filled and you can go home with your prescriptions. A cell phone charger, so if you have one that is 6 foot or longer, that makes it a little bit easier to plug it in. It's usually behind the bed and you don't want to have to twist and turn trying to reach your phone. Bring pajama pants, sweatpants, leggings, shorts, something like that. So when you're in the hallway walking, you won't feel so exposed with that gown open to the back. Bring any toiletries that you might need, such as a toothbrush, toothpaste. But one thing I do want to suggest is do not overpack. You only want to bring your essentials. There's not a lot of room and you just don't want to have too much to have to take home. The other thing I want to talk about is preparing your home for surgery. So you have to think a little bit about when I come home, what will I need to do and what do I need to have done before I have my surgery? So you might want to clean, you might want to catch up on laundry so you don't have to fool with that when you get home. Create a safe, comfortable, and accessible environment to support your recovery. Remember, you'll be on a 10-pound lifting restriction, and that's going to be for 6 weeks. So you might want to organize your area. Things that you frequently use, you might want to make sure that it's at a waist level. Prepare and freeze pureed foods. You'll refer to the blue post-op papers or the post-op diet video, a little bit more about doing that. And you'll want to stock up on approved liquids. So refer to the blue post-op diet papers or the video for that as well. And this is a very important reminder. Remember, the day before your surgery is clear liquids only. Refer to your pre-op paper list of approved liquids. So these are your green papers and it's on page 4. Reminder, there are no protein shakes and no solid food the day before your surgery. Then you are nothing by mouth after midnight. So from midnight on to the time of your surgery, nothing by mouth. Nothing to drink, nothing to eat, and no medications by mouth. So once you arrive to the hospital, you'll check in at the front desk. They will let you know which direction to go. Then a nurse or an associate will come to get you from the waiting room. The nurse will take you back to get you ready for surgery. Once your medications are given by the nurse, they've started your IV, they've prepped you for surgery, then they will allow your family to come back and sit with you. You will get to see your surgeon and your anesthesia provider before surgery. Okay, so once surgery's finished and you finish your time in the recovery room, you'll be transported to your inpatient room. This will be on a bariatric specific floor. All the nurses will be trained on how to take care of you. After arriving to your unit, the nurse will check you in, they'll check your vitals, they'll be monitoring you all throughout your stay. Within 2 hours of arriving to the room and you're safely awake, it's time to start walking. We talk a lot about walking and how important it is. But walking helps you to heal faster, it helps the GI tract to wake up, and it helps prevent blood clots and pneumonia. You'll be given an abdominal binder, and we want you to wear that binder when you're walking, and we want you to walk every 60 to 90 minutes while you're awake. Now at night, if you can get some sleep, get a little bit of sleep. Rest is important too, but get up and start walking and remember how important it is. You'll also be given an incentive spirometer. It's a little picture down there in the lower left-hand corner. We'll want you to use your incentive spirometer every hour times 10. Now you might not want to do it all 10 times at one time. You might get a little sore. So using it 3-4 times every 15 minutes or so might be what works best for you. But your incentive spirometer helps you to prevent pneumonia as well. And I know everybody's excited about starting the clear liquids after surgery. You will be started on your clear liquids when your bariatric surgery team decides you are ready. Clear liquids are to be decaffeinated, no carbonation, and sugar-free, and that's actually suggested for life. You'll be provided the 1-ounce medicine cups, as you see below me, and you'll drink from those. It'll be very, very small, slow sips in the beginning. Your goal for your fluids is going to be 48 to 64 ounces daily. You'll be given a tracking chart. It'll be much easier if you keep up with how many ounces you're drinking. That way your team knows how well you're doing, and that helps you get discharged from the hospital. So you're probably wondering when you'll be discharged to home. Once you're tolerating your clear liquids, your pain and your nausea are controlled with oral medications, your bariatric surgery team feels you are ready, then you will be discharged home. When you go home, remember to take home your binder and your incentive spirometer. You'll need someone to drive you home and to stay with you for the first 24 hours. You may receive a survey from the hospital, and we appreciate your feedback, and of course we're hoping we get all 5 stars. Okay, so now that you're discharged home, you have to continue your post-op care. First thing you want to do is continue to walk. Remember, you have to walk every hour. You'll want to build up to 10 minutes out of every hour. Continue to use your incentive spirometer. You'll want to use it 10 times every hour, and you'll want to do this for your first 2 weeks after surgery. Make sure that you're reaching your fluid goal. It is vitally important that you are reaching your 48 to 64 ounces of approved liquids. If you're confused about liquids, check out our other videos about fluids and post-op diet, or look at your blue post-op paperwork. Remember, you're on a 10-pound lifting restriction. This is going to be for the first 6 weeks after surgery. You want to avoid any excessive bending, stretching, pulling, pushing. This excessive bending and stretching, that's going to lead to more pain. It's normal to be sore and it's normal to be tired. Remember, you had surgery. So take pain medications as prescribed and rest as needed. Remember, no driving while you're taking pain medication, and no driving the first week after surgery. Most patients resume driving at 2 weeks after surgery, and most patients drive themselves to their 2-week post-op appointment. You will get a call about 1 week after surgery. The nurse or the dietitian will be asking you, are you reaching your fluid goal, and how you're doing, how's your pain? We want to know how you're doing, and we want to assist you. But if you're not reaching your fluid goal and you need to talk to someone, please call the office. That's what we're here for. Then you'll have your 2-week appointment. It's going to already be scheduled for you. And follow up with your medical doctor or specialist if you have any medications that may need adjusting. And please, if you have any questions or you have any concerns, please call the office. Our number is 513-682-6980. That's what we're here for. We want to help you. If it's after hours or on the weekend, please call the same number. It will walk you through instructions on how to reach the on-call physician. And good luck to you. And check out the other videos. You may find a lot of useful information, but I suggest checking out the post-op diet video and signs and symptoms to report to your physician.